Monday Health Minutes, sponsored by Valley Health.
Hi, I'm Melanie Shaver. This is Valley Health Minutes, and today we're talking about some women issues that may be creeping into your life or someone that you know and love. If you're having uncomfortable pressure, there could be a medical condition responsible for it, and there might be help for you. So Dr. Caleb Huff is talking with us about that today. So we're talking about prolapse. What exactly is that?
Right, so prolapse is kind of an umbrella term that covers several different conditions. Frequently you'll hear patients or family members talk about a dropped bladder, and that usually is referring to one of the types of prolapse. So not to get too technical, but either the bladder can be bulging down, the uterus or cervix can be dropping low, or the rectum may be bulging.
And this causes what kind of symptoms would you notice?
Pelvic pressure, it can be uncomfortable. Sometimes I'll hear patients describe it as like sitting on a ball sensation, like just uncomfortable, something isn't right feeling. There can be urinary incontinence or constipation that can come along with this as well. Feeling like you need to push something back up inside. And it can be worse as the day goes on, or if you're lifting heavy things, it can be worse toward the end of the day.
Okay, so symptoms you can watch for. Is it part of an aging process? Is there something is it after you normally have kids, or what age group would see this kind of problem?
So these are, it's never a normal condition, but it is very common, especially after having children. It does increase with age, family history as well, and sometimes profession. If you're doing a lot of heavy lifting in your job, that can all contribute to this condition.
Okay, so if you're experiencing this, what kind of procedures are there out there? What can help you?
Well, the first thing to do is to mention it to your doctor, and if you're not getting anywhere, keep mentioning it and say that this is something that's bothering me, it's uncomfortable, and I want to get it taken care of. Some doctors may not know that there's treatment for this as well. There are some non-surgical treatments, which is called a pessary. That's a kind of a rubber device that can go up inside and hold things back. Most of the time I find that most women don't want to do that, and surgery is the next option. There are a number of different surgeries that I can do that can help fix that prolapse. Either it can be done vaginally or it can be done abdominally via the robot technology. The advantage of the robotic technology is very quick return to normal activity in life.
So what can you expect as far as that downtime? If you go for the robotic option, are you out of work for a couple of days? Do you have restrictions afterwards?
So most of the time, most of my patients either go home the same evening or the next morning. Very little downtime. Of course, there's weight lifting restrictions. You want to make sure you're not going right back to heavy lifting. Let your body heal. But after about a month, you can start back to normal activity from that procedure.
And what have you seen with your patients that have gone through that? What is their quality of life like after the procedure?
It's an immediate, all that sensation is gone. Of course, you're sore from the surgery, which can take some time to heal, but that sensation that was really bothering them is gone.
So that means just everyday life is a lot more comfortable.
Right.
Are there any concerns that if it goes untreated, could it cause other issues?
Yes, in the severe case, it can cause frequent urinary tract infections, even urinary retention where you can't pee, you can't urinate, or chronic constipation. Sometimes the prolapse can be so severe it can be bulging and hanging out, and that can be just completely debilitating for patients. They don't want to leave the house, they are embarrassed, they can't walk 10 steps without feeling that coming out, and then they stay at home, and it just gets worse and worse.
And that's when you talk to your doctor, and insurances typically cover the procedures.
Yes.
Yeah.
Yes.
It can definitely help you and be within financial reach for most people.
Right, absolutely.
All right, wonderful. Doctor, thank you so much for being here and sharing this information with everybody. I'm sure it's enlightened a lot of folks.
Thank you
so much. Thanks for being here for Valley Health Minutes.